Well, welcome back. 8:23 this Wednesday morning. August is National Eye Exam Month. It's a reminder that protecting our vision is just as important as protecting the rest of our health.
Yeah, joining us this morning is Dr. Claire Colon from Wayne State University to talk about why regular eye exams matter and what to watch out for. Dr. Colon, we appreciate your time this morning. Why is it important to recognize National Eye Exam Month?
Hi, good morning, everybody. So as we know, we depend a lot on our vision for our daily lives, anywhere from driving to reading to basically just going about our day. There are many things that can lead to vision loss, and a lot of them are silent, and you don't really notice them until they become an issue. So that's why I think that eye exams are important to do at least routinely. And unfortunately, as we age, we start losing vision. We kind of gonna get we want to get up ahead of that and try and prevent any vision loss or try and treat any vision loss. There are many leading causes of vision loss here in the States. The most common one is cataracts. This is a reversible type of vision loss that usually involves a surgery. And that can be very impeding in vision. It can lead to not being able to read, having glare while driving at night, or having difficulty even seeing the street signs, and can be taken care of by seeing one of your eye doctors and potentially doing a surgery. Another one of the things that are silent and you don't notice until it's a problem, and it's actually pretty pervasive in our state, is called glaucoma. Glaucoma is an issue of pressure in the eye that doesn't really hurt. It doesn't show redness. It doesn't show anything, and it steals your peripheral vision. It's usually irreversible. And that plus macular degeneration are two things that we want to be screening for in our patients to make sure that we can prevent it from taking your vision. On top of that as well, in our patients who are diabetics, they need to be screened at least once a year with a dilated eye fundus exam to check for diabetic retinopathy, which is another one of our thieves of vision here in the States. That is either the second or third leading cause of vision. And that's why we do really need to do our routine exams and check our eyes at least once a year just to make sure nothing is going on.
Yeah, it's one of those five senses, right? The sound or the sight there, eyesight being that. Definitely a good idea to make sure that you're checking up on that as well.
Yeah, and I know you mentioned at least once a year is good for scheduling that eye exam, but what if somebody's noticing a couple of warning signs maybe that would make them want to get in sooner? Would you be able to go through a couple of warning signs that could tip us off to something maybe being wrong?
Oh, absolutely. So number one is blurry vision. There are different types of blurry vision. Most people get a little bit of blur when they're dry, and unfortunately, we are also in an era where we're looking at TVs and screens and phones and a lot of computer screens that can dry our eyes. Sorry. So one of the warning signs is blurry vision that doesn't go away, blurry vision that gets worse with time. Feeling like you're missing things on your peripheral vision, like suddenly you were used to seeing people right on your side, and now you can't see them very well, or it's very blurry things that are right on your side. If you're having issues with controlling your blood sugar too high, blood sugar too low, also a good reason to get in to see one of your ophthalmologists. Another one that happens fairly often is floaters. So if you had the one floater that you've been close friends with for a long time, that is not usually something to be very worried about. But if you suddenly have a lot of new floaters, you start seeing flashes of light in your eye, or you start seeing kind of like a big blur or shadow covering your vision, those are reasons to go see your ophthalmologist immediately. And another big one for macular degeneration specifically, one of the things that you can do is you can look at those like grid papers, graph papers that have like all the little squares and the straight lines, and you look at that little paper, and if you start seeing straight lines or lines that should be straight are suddenly wavy, those are signs that you should be seeing an eye doctor pretty quickly.
Yeah, it's actually funny. A couple years ago, I had that test where I was looking at the straight lines on the paper, and it was all wavy, and it was something to do with fluid that was building, I believe, in my retina area, or
That is correct.
one. Yeah, and it was stress is what it was actually. The cause is what the doctor said. That's just one of those conditions that can tip you off to something else going on in your body. Can you kind of talk about that? Because I mean, our eyes can really paint a picture of health in our body.
Absolutely. And not only that, we can see in your eyes usually something before you even feel it. Like I know a few of my colleagues that have been able to diagnose diabetes by looking at patients' eyes and a patient never knowing that they even had diabetes. And so any one of those things, there's many things that can present in the eye. And like you said, this type of fluid buildup that kind of accumulates in your retina can be related to stress or steroid use or some certain medications that can have these side effects. There are fortunately not a whole lot of medications that have vision side effects, but there are medications that have vision side effects. For example, our patients that are on a medication called Plaquenil or hydroxychloroquine, they usually used for autoimmune issues, do need to get yearly checks to make sure that they're not having this fluid buildup, like you said. And other things that you could see, the flashes and the floaters, like I spoke before, it can be signs of something like a retinal detachment that need to be taken care of immediately. Patients who have high blood pressure can also get some sort of vision loss or intermittent vision loss that can be equated almost to a stroke, and that can be that, and then that needs to be taken care of immediately, and check that you're not actually having a stroke. So there's a lot of things and a lot of little nuances to vision that can like tip you off to something else going on in your body.
Yeah, very interesting. I feel like all of our organs and things are so connected, and you can always tell one by gauging one aspect of your body.
Absolutely. All of that
Absolutely.
interconnection within your body is, of course, something very important to really keep in mind. Now, I know that there's a couple of different conditions, too, that maybe might be hard to notice at first. I know I dealt with high eye pressures when I was younger.
Oh, wow.
So that was something that I didn't really have symptoms for, and I wouldn't have known unless I was regularly getting my eyes checked. Can you speak to the importance of making sure that you're getting your eyes checked because of some of those things that might be difficult to even get the warning flag for in the first place?
You're absolutely correct. I deal with this every day. So as a glaucoma specialist, we see a lot of patients that come in with elevated eye pressures that could potentially cause irreversible vision loss. And it tends to run in families. If you have anybody, first degree family member or second degree family member with a history of glaucoma, you should get checked immediately just to make sure that there's nothing going on. And that's why I harp on the importance of at least routine tests, at least once a year, to make sure that you don't have anything pervasive going on. Because, as you said, this issue with the elevated eye pressure, for the vast majority of patients, it is completely silent. You don't know what's going on. You have a completely clear eye, no pain, no vision loss at the beginning, and it's not until it's been there for years and years and years and years without you knowing that it's affecting your peripheral vision. And then when usually by the time the patient notices, it's late in the game, and then we fight to save the little bit of vision that's going on. And same thing happens with diabetes. Diabetes is also a disease of the retina as well that can also cause swelling in the back of the retina. And you don't notice that this is going on until it's affecting the center of your vision. And that's why we harp on doing yearly exams. And if we do discover diabetic retinopathy, then we kind of gauge how often we need to see you depending on the severity of diabetic retinopathy. Thankfully, most of our patients have mild diabetic retinopathy, but those who end up graduating to swelling and other things going in the eye, we need to see more often, to treat more often, to make sure that you don't lose vision.
Yeah, so we've got about 20 seconds left. You know, if you are somebody with perfect vision, or you're somebody who has regularly seen an eye doctor for your entire life, what is the grand overarching picture that you would paint for somebody? Would you tell them, yeah, you need to still stay on that eye exam? If you've never been to an eye doctor, what would you tell that person and where to start?
It depends a lot on their age. Usually with older patients, we see them more often because they're more at risk of things going sideways versus somebody who's young. But we still recommend doing an eye exam at least once every 1 to 2 years to make sure that nothing is developing. On top of that, I would recommend to them the same thing that we recommend to our patients is try and keep a healthy diet. Usually diets high in like leafy greens and antioxidants and stuff and things like that can actually help the eye maintain health and help the eye actually prevent some of these things. Try and avoid smoking, and not healthy, balanced diet and exercise can actually also help the eyes stay healthy.
All right. We appreciate your time this morning. Thank you so much for shedding some light on National Eye Exam Month. We appreciate it.
Absolutely. It was lovely being here. Thank you, guys.